It puts some control in your hands. This isn't something that you're doomed to have forever and have to take medications. I'm Dr. Bliss Lewis. I'm a psychiatrist and an integrative medicine doctor. And let's talk about hypothyroidism, and let's continue this conversation about what are the lifestyle factors which we can control and at least know about that may be contributing to hypothyroidism, and what can we do. And also let's look at what is the research, right? Like, are there research studies to link lifestyle factors and thyroid issues? So first of all, a good diet, a good clean diet is very important for thyroid health. And certain deficiencies, for sure, iodine, selenium, zinc, those can impair thyroid function. There's also potentially a risk from eating certain foods. Those are called goitrogens, and we don't understand completely how that works, but certain foods such as soy, cruciferous vegetables like broccoli or cauliflower can interfere with thyroid hormone production when consumed in large amounts, especially raw, right? So cooking kale, steaming kale, or broccoli or anything like that will reduce the goitrogenic properties, or like the risk to the thyroid gland from eating those kinds of foods. Another cause, lifestyle cause of low thyroid is chronic stress, right? So chronic stress can disrupt the hypothalamic, pituitary, adrenal axis, which regulates thyroid function. So stress can lead to cortisol levels being high, and that can have a negative impact on production of thyroid hormones. So reducing stress is another way to take care of the thyroid gland. Poor sleep can also contribute to thyroid issues, and we know from research studies that sleep deprivation can affect TSH levels and thyroid hormone levels, eventually to the point of hypothyroidism if this is a chronic issue. Exposure to toxins in the environment, in our food, in cosmetics, can contribute to thyroid issues. So that could be heavy metal exposure, lead, mercury. It could be any endocrine disrupting chemicals, and there are many. Bisphenol A, phthalates in various products. All of those potentially are problematic for thyroid function. There's more and more research emerging linking those various chemicals to thyroid issues. Another cause of thyroid issues is smoking. So the chemicals in cigarettes can have a negative impact on the thyroid and increase the risk for developing hypothyroidism. Excessive alcohol intake can impair thyroid function and also lead to hypothyroidism. So alcohol affects liver health, and thyroid hormones are converted in the liver. So if the liver is not well, that can contribute to thyroid issues. So the reason we're talking about this is because a lot of these factors are something you can control, right? So it's not like, oh, you got this diagnosis of low thyroid or hypothyroid or like subclinical hypothyroidism and you're stuck with it forever. No, it's like it's getting that diagnosis or figuring out that your TSH is slightly off or your thyroid hormones are low, hopefully will like motivate you to research and look up like, oh, why is this happening and what can I do to undo this situation, right? And I have seen lots of patients when they implement lifestyle changes, we see the TSH normalize, right? So high TSH is bad, right? Optimal TSH is below 2. That means that there's like a good amount of thyroid hormones being produced. And with lifestyle improvement, right? If you're somewhere in this like between 2 and 4, you can bring it down, even if it's more than 4, right? So you can make a big improvement in your thyroid health by addressing these lifestyle factors. So that's hopefully like a hopeful message because It puts some control in your hands. This isn't something that you're like, doomed to have forever and have to take medications. Like, figure it out for yourself. Like, what lifestyle factors can you improve to improve your thyroid function? Thank you for listening. Feel free to share any of your thoughts about this in the comments.